Hello everyone, my name is Pim ten Broeke. I work for the Ministry of Health of the Netherlands and I'm part of the Young Kristine program. And today I'm interviewing Kristine Sørensen. So thank you for being here and making time for us. Could you briefly introduce yourself?
Yes. So my name is Kristine Sørensen. I'm the president of International Health Literacy Association and I'm also pleased to be here in Kristine.
Very good, alright. So we're going to talk about health literacy, and this is something that you research a lot. Can you briefly tell us what health literacy is?
Yeah, so when I first heard about health literacy, I didn't know what it was, but we started to exploring it because we had got funding from the European Union to make a survey on health literacy. And health literacy is really about the knowledge and motivation and competencies that people have to find and understand and use information to take decisions about health in everyday life. So when they're ill and it's about treatments, if it's about navigating healthcare systems, if it's about prevention, all the risk factors that we know of, it's not healthy to smoke or to drink too much and you have to do exercise. But also about health promotion, so trying to stay healthy. And importantly, health literacy is not about individuals only and how we keep ourselves healthy. It's also about how health providers, organizations, hospitals, healthcare systems, political systems, how we shape environments to make it health literacy friendly so that people can find the information they need and can navigate all the health offers and so forth. So we always say that it's a two-sided approach. I usually say it's like a coin. You have two sides. One is your individual health and family health, but the other part is really how do we design societies.
Okay, it's a collective part.
Yeah.
Okay, very interesting. So you're finding very hard to put this on the agenda. So when is this fight for you? Is it done? When do you know that you have had your success?
Yeah, I love that question about what is success for us. And I think, of course, health literacy develops over the lifetime, so we are never really done, and we are trying to improve health literacy for all. So it's an ongoing journey. But I do hope that we can try to integrate health literacy in national planning. So a success for me would be when countries have national health literacy action plans, just like you have for diabetes or for cancer or for anything else. That would be a major milestone. And only a few countries have that today. So.
Okay. Do you have a good example of a country that has a plan?
Yeah, so for example, Portugal, Scotland, Norway. Yeah, so there are countries that have been front runners. Some have not a national action plan, but they have added health literacy as part of, for example, cancer control plans. So in some areas it's like a subsection, but at least it's being discussed. But we have also many countries where it's not yet on the agenda. I do think COVID-19 has helped us because there we were suddenly forced to learn about a new disease. We had to change and redesign, all the facilities and so on. So that has, I sense here in Kristine, the conversation has changed.
Yeah.
People know about health literacy now.
Okay, so there's a job to be done for governments. But there's also probably research that has to be done. What's the most important research that has to be done right now that isn't being done right now?
For us, it was very clear what is measured can be done. And having national health literacy surveys has certainly stimulated action. So I would hope that all member states in the EU, for example, and also beyond that, will start having national surveys on health literacy.
Okay, interesting. And you're also looking for health literacy champions. What does it mean to be a champion, and how can, for example, I become a champion?
Yeah, so champions are people that believe in making health literacy accessible for all and develop the potential of people. And we've seen the big changes in organizations and communities where there are actually people that take on this task to make communication more easy to understand, to focus on plain language, to make services more accessible, products more user-friendly. So there are many ways to do it, but somebody needs to do it, and that somebody could be a health literacy champion.
Okay. Do you have like a best practice of someone who really put in a lot of effort? And
So, for example, in those countries where there are now national action plans, it has been champions within the ministries of health or health authorities that have been carrying that challenge, together with researchers who've done the research. So normally it's not one person, but more teamwork. But certainly, again, it needs someone to take ownership, and that's where the difference can happen.
okay. And if someone watching wants to be a champion, they want to help you in this fight, how can they start? Can they contact you or?
Yeah, so they can find me on LinkedIn. Everybody is welcome to contact me. And they can sign up for membership of Health Literacy Europe, the European platform, or the International Health Literacy Association.
Okay.
And I look forward to work with
Very
everyone
good. Very good.
into this.
And is there anything else that you want to say to our audience?
Well, I think health literacy is important for everyone. It's the outcome of education, but not only formal education, also non-formal education and informal education. So what we learn at home, at the workplace, and so on. And therefore, health matters for everyone, but health literacy also matters to everyone.
Yeah. Okay. Well, it's clear. Thank you so much.
Thank you. Thank you for the invitation.
Yeah.